You've probably heard that all autistic people are the same, that they lack empathy, or that autism is caused by bad parenting. But what if everything you thought you knew was wrong? Let's break the myths and uncover the truth about autism. Because real understanding starts with real facts. Think you know the truth about autism? In this eye-opening video, we separate fact from fiction by debunking some of the most common myths about autism. Whether you're a parent, educator, or just curious, this is your guide to understanding what autism really is and isn't autism. Myths versus facts. Debunking common misconceptions. Autism spectrum disorder is a complex neurodevelopmental condition characterized by differences in communication, behavior, and social interaction. Despite increased awareness, numerous myths persist, leading to misunderstandings and stigma. This video aims to debunk common misconceptions about autism, fostering a more inclusive and informed society. Myth 1. Vaccines cause autism. One of the most pervasive myths is the belief that vaccines, particularly the MMR vaccine, cause autism. This misconception originated from a now debunked study published in the 1990s, which falsely linked the MMR vaccine to autism. The study was retracted, and the doctor who published it lost his medical license due to unethical practices. Extensive research has since found no credible evidence supporting a link between vaccines and autism. Myth 2. Autism is a mental health disorder. Autism is often mistakenly classified as a mental health disorder. In reality, autism is a neurological developmental condition. While individuals with autism may experience co-occurring mental health challenges, such as anxiety or depression, autism itself is not a mental illness. Recognizing autism as a neurological difference is crucial for appropriate support and understanding. Myth 3. All individuals with autism are the same. A common stereotype is that all individuals with autism exhibit the same behaviors and abilities. However, autism is a spectrum, meaning it encompasses a wide range of experiences and characteristics. As the saying goes, if you've met one person with autism, you've met one person with autism. Each individual's strengths, challenges, and needs are unique. Myth 4. Autism only affects children. While autism is typically diagnosed in childhood, it is a lifelong condition. Many adults live with autism, some diagnosed later in life due to evolving understanding and diagnostic criteria. Recognizing that autism affects individuals across all ages is essential for providing appropriate support throughout the lifespan. Myth 5. People with autism lack emotions. Another misconception is that individuals with autism do not experience or express emotions. In truth, people with autism have a full range of emotions. They may express feelings differently, but this does not indicate a lack of emotional depth or empathy. Understanding and respecting these differences is key to meaningful connections. Myth 6. Autism is caused by poor parenting. Historically, autism was erroneously attributed to cold or unresponsive parenting, a theory now thoroughly Current research indicates that autism has strong genetic components and is not caused by parenting style. Myth 7. Individuals with autism are intellectually disabled. While some individuals with autism may have intellectual disabilities, many possess average or above average intelligence. Autism affects individuals differently, and cognitive abilities can vary widely across the spectrum. Myth 8. Autism can be cured. There is currently no cure for autism. However, early and intensive behavioral treatment can, in many cases, reduce the severity of symptoms and help individuals develop adaptive skills for daily living, emotion and behavior regulation, and social engagement. Dispelling myths about autism is vital for fostering acceptance and support for individuals on the spectrum. By embracing accurate information and challenging misconceptions, we can create a more inclusive society that values neurodiversity and empowers all individuals to thrive.